start, I would wash my hands. I would introduce myself. So like, hi, I'm Tristan. I'm gonna be your nurse today. I'm performing a heart and peripheral vascular assessment on you today. Can you tell me your name and date of birth?
My name is David Straub, 4/13/99.
Nice to meet you. And I would check his armband to make sure it matched. And then I would provide privacy for the assessment, and I would put on gloves if I had them here. And yeah. Oh, and then have you ever had a heart attack?
I have not.
Have you ever had a blood clot?
I have not.
Awesome. All right, so to start today, I'm going to check for jugular vein distension. So can you turn your head to the left, please? I don't see any distension there, but if I did see jugular vein distension, I would alert the physician to let them know. And now, do I have permission to touch your neck?
Mm-hmm.
I'm going to check your carotid pulses on this side. I feel it here. It feels strong and like a normal rhythm. Check on this side too. I feel it here too. Strong and normal on this side as well, like a 3+ on both sides. Now I'm gonna use the bell to check for bruise in your neck. Can you hold your breath when I do this, please?
Okay.
You can breathe. And then can you hold your breath again, please? Thank you, and you can breathe. I didn't hear any bruise on either side of it. And so after that, I am going to move to, can you lay down for me?
Mm-hmm.
Thank you. And take off your shirt for me too, please, if you don't mind. Awesome. So I'm checking for heaves, which are on the anterior movement. I am checking for, or no, lifts are on the anterior, checking for lifts on the anterior movement. Heaves are on the point of maximum impulse, and then the pulses are in the intercostal spaces, and I don't see any of those while I'm looking for them. Thank you. You can sit back up. And now I am going to check your different heart locations. Thank you. So the first one I'm going to check is the aortic, and it is in the second intercostal space to the right of the sternum. And now I'm going to check your pulmonic, which is in the second intercostal space to the left of the sternum. You can hear S2 at both of those points. Now I'm going to check Erb's point, which is in the third intercostal space to the left of the sternum. You can hear murmurs here. And now I'm going to check the tricuspid part, which is in the fourth intercostal space to the left of the sternum. And now I am going to check the mitral location, which is in the fifth intercostal space on the mid-clavicular line. And at the tricuspid and the mitral, you can hear S1. Perfect. So now I'm going to check your heart rate and rhythm right here. Awesome, thank you. The heart rate, I would say, is 64, and the rhythm of it is strong and normal. And so after that, I am going to, now I'm going to check your peripheral vascular area. So can you, you can sit back, I'm going to check your leg. Thank you. So I'm looking at the leg, and the skin, it seems, it's kind of pale up here, but then it goes to tan as you go down the leg, and it seems intact. Do you have permission to touch your leg?
Mm-hmm.
Thank you. I'm gonna look all around it. I'm looking for lesions. I don't see any on the skin right here. Well, I see a couple primary lesions. I see a freckle, or two primary lesions in the form of freckles on the medial aspect of the foot. I would say they are both like 1 millimeter in diameter. They feel flat. They are round. And I see another primary lesion on the anterior part of the leg. I would say it's probably less than 1 millimeter in diameter, and it's round and it feels flat here too. And those are all the lesions I see on there. I don't see any secondary or vascular lesions on his legs. And the hair distribution on it seems normal. It seems evenly distributed. And now I'm going to check for the temperature of your leg. I'm going to use the back part of my hand. I'm going proximal to distal. The skin feels dry and the leg feels warm but cooler as you move your way towards the toes. And so now I'm going to check for edema on your leg. So I'm going to start here. I'm going to feel as I go down. I'm going to lift your leg up, please. Thank you. I don't see any edema as I felt down. I don't feel any as I go down the leg. And so now I am going to check the pulses. So the first one I would check, I'm just going to verbalize it, would be the femoral pulse. But now I'm going to check the popliteal pulse, so which would be behind the leg right here. And I found it, and it seems to be, I would rate it like a 3+ here, and it has a normal rate, and it's strong. And so now I'm going to check the posterior tibial pulse, which, can you move your leg to the side for a little bit, please? No, this way. Yep. Thank you. It's right behind here, and I feel that one. It is strong, 3+, and normal rate as well. And now I'm going to check your dorsal pedis pulse, which is on the top of the foot. So I'm going to check right in this area. And I found that one too, which is normal of 3+ as well. So now, after that, I am going to check for, I'm going to check his toenails and stuff. So for the color, they seem intact. They don't seem any cracks or any lesions in them. And the color of them, I would say they're clear, but the skin underneath would be pink. And so now I'm going to test the capillary refill in his toes. So, okay, check here. I would say the capillary refill in his toes is about 2 seconds. And now I am going to check for ulcerations on his feet. So I'm going to look around the feet first. I'm going to make sure I check all sides for it, see if I see any, and I want to check in between every toe to see if I see any ulcerations. And I do not see any in between his toes or on his foot. I didn't see any ulcerations or anything. And so I think that covers it all. So for my closing, I would document my findings that I found throughout the assessment. I would make sure the patient is comfortable in his bed. The bed's in the lowest position. I would make sure that his items are in reach. I would make sure the collie's in reach. I would make sure the side rails are up ×2. And I would throw away my supplies I use would be the gloves that I had on my hands. And yeah. So thank you.